Hello everyone friends, Mr. Dent Clinic, and now I want to tell you a little about the process that is happening here. Here we see a scanned tooth, the one that had to be prepared for a ceramic crown. Previously we made it depulpated due to a very deep carious cavity. I have all these photos. I may post this clinical case later if it is cool. Here we have this tooth, which we have prepared for a ceramic crown. The preparation here was quite voluminous because since the teeth are depulpated, I no longer see the point of preserving the hard tissue of the tooth in that volume to make some kind of minim-invasive preparation. Here I have already prepared a table for myself. As usual, I have a photo of the tooth that I will need to recreate on my table. Today we are working with this fourth tooth and we will try to draw it. There is also a palette in which a little ceramics are diluted, a little paint, glaze, which we will apply later. There is a special holder to hold the crown. Sometimes I use a liquid trigger, but here I just put it on a tablet. And a little brush with different thickness of the working part in order to bring the glaze somewhere, apply ceramic somewhere if necessary, and then paint some fissures with thin brushes. I also use a file to distribute the paint inside the fissures. And while we were talking, a synthesized crown came out of the stove. Many people ask, why does the crown first have such a purple color and then turn white? This is the process of synthesizing IMAX, a palette of ceramic. Now it has already sounded. We can take it all out of the stove, let it cool down. Close the stove, let it all freeze and work with the color scheme. Apply color. You can do it all at once. You can do it several times. It depends on how convenient it is for you, how much you are in a hurry and you have time. But it's very cool. It's nice when you do the whole process from start to finish. I was striving for this and wanted to achieve it. Have a nice day.